fascinating how, as life changes, how priorities evolved. And that's one of the reasons I believe so strongly in a freedom first framework. If your doctor recommends a specialist and you have a Medicare supplement plan, one question might simply be, do they accept Medicare? And the next question is, how early can I get an appointment? You have a different kind of plan, you're going to be asking, are they in my network? Do I need a referral? Will this require prior authorization before I can even go see them? Hey everyone, welcome to Coffee with Casey, the weekly conversation that helps you navigate Medicare with confidence. I'm Casey Alban, and whether this is your first episode of Coffee with Casey or whether you've been joining me here every week, I'm glad to see you. We haven't met yet. Again, I'm Casey Alban. I'm the Senior Medicare Advisor here at the Alban Insurance Group. We're a family-owned agency based in Margate, Florida, and we have been helping families navigate Medicare for more than 30 years. From our office right here in South Florida, we've been privileged to help families all throughout Florida and across the country make confident Medicare decisions. And as an agency, we've helped thousands of people through this transition. In fact, I've personally had the privilege of helping hundreds of families build Medicare strategies over the last couple of years that fit the life that they actually want to live. Over the years, many of my clients have started calling me their Medicare co-pilot. And I've always smiled when they say it because I think it perfectly describes my role. And it also goes along with the fact that I'm a pilot. One of the things that flying has taught me is that every successful flight starts with a plan. Before takeoff, you understand your route and map it out. You prepare for changing conditions, and you always know your alternatives and options in case something unexpected happens. Well, I happen to believe that Medicare should work the exact same way. So my role is not to tell you what to do. Like a good co-pilot, it's to be in the right seat next to you to help you understand your options and think through all the trade-offs so that you can confidently navigate one of the biggest healthcare decisions that you're going to make in retirement, if not in life. So grab a cup of coffee and let's navigate Medicare together. So for today's conversation, I want to introduce or maybe reinforce something that you've heard me talk about a bit lately. I call it my Freedom First framework because after helping hundreds of families myself and watching our agency help thousands over the last 3 decades, I've noticed something very clear. The people who seem happiest with their Medicare coverage 5, 10, 15 years later, they're usually not the ones that are talking about premiums. They're talking about something much more valuable. Freedom. Freedom to choose their doctors and decide what hospitals and treatment centers they want to go to. Freedom to travel. Freedom to get a second opinion wherever they want to. And freedom to make healthcare decisions with their doctor, not their insurance company. Today's conversation is about one of the first times that freedom really gets tested. Today, your primary care doctor says, I'd like you to see a specialist. How that experience unfolds often depends on the Medicare strategy that you chose years earlier. Type freedom in the comments if having choices in retirement is important to you. So this is the first real test of your Medicare strategy. When you're healthy, almost every Medicare plan feels like a good plan because you haven't used it, right? I mean, you're seeing your family doctor once, maybe twice a year, if that. Maybe you're taking 1 or 2 medications. Everything seems super simple. But here's what I've learned. Your Medicare strategy isn't really tested when life is easy. It's tested when something changes. The specialist, the diagnosis, the unexpected phone call that comes saying, hey, we found this and I want you to go see so-and-so. That's the moment when people begin discovering how their coverage really works. Now, if you've worked with me, one thing you know is that I try very hard to avoid telling people what they should do. Instead, I encourage them to think about how they really want their healthcare to work. Because Medicare really offers 2 very different philosophies. One of them is built primarily around like managed care networks. The other is built for freedom of choice. Now, neither one's perfect. Neither one is automatically right for everyone, but they do create 2 very, very different experiences. If your doctor recommends a specialist, and you have a Medicare supplement plan, one question might simply be, do they accept Medicare? And the next question is, how early can I get an appointment? You have a different kind of plan. You're going to be asking, are they in my network? Do I need a referral? Will this require prior authorization before I can even go see them? Question. If someone you loved needed a specialist tomorrow, which questions would you hope that they'd be asking? Freedom becomes a lot more valuable over time. Something very, very interesting happens in retirement. At 65, or even before 65, most people are asking me, what's the monthly premium? But at 70, 75, or even older, they're asking me much different questions. They're asking, can I get in to see this doctor? Will they take my plan? Can I go to Mayo Clinic? Will I be able to get a second opinion? It's fascinating how, as life changes, how priorities evolved. And that's one of the reasons I believe so strongly in a freedom first framework, because freedom tends to become a lot more valuable as life becomes more complicated. We've already started seeing examples this year of hospital systems and large physician practices renegotiating contracts. We see doctors leaving networks, cancer centers like Moffitt over in Tampa not participating with certain plans. Those headlines really aren't about insurance. They're about people. People that are just trying to continue seeing the doctors that they trust. And that's why I encourage people to think beyond today's premium and really ask themselves, how do I want my healthcare to work if my life becomes more complicated? Now, it's about more than just specialists. That same philosophy extends beyond physicians in general. Think about prescription coverage. Think about traveling. Think about moving. Think about getting care while you're up north visiting your grandchildren. Freedom isn't just about one doctor's office. It's about building a healthcare strategy that adapts as your life changes. And that's really what the Freedom First framework is all about. Great example. Uh, my dad and my stepmom, they have a summer home up north, and he had a recent health issue where he needed to get care. And because when he turned 65 and from being in the business, he clearly knew the benefits and trade-offs of both plans. He had a freedom-based Medicare supplement plan. So for him, there was no worry about whether he was going to be able to be treated. And everything that he had done, it worked exactly the same way there as it would have if he was here at home. His plan was permanent and portable. He didn't have to worry about whether they were in the network, whether he was going to get hit with large out-of-network costs, or whether if it was deemed a not emergency, he might have to get on a plane or get in a car and drive home. Today's conversation isn't about trying to convince anyone that one plan is better than another or one path is better about another or better than another. It's really about making sure that you clearly understand the trade-offs, because every single Medicare decision that you make, it involves trade-offs. The key is making sure that those trade-offs really align with the kind of retirement and life that you want to live. Like when I sit down with someone, that's the kind of conversation that we're having, not which plan is going to be the cheapest, but it's about how do you really want your healthcare to fit into the retirement that you've worked so hard to build. So let's look at some of the common questions that I often hear. A big one that I get as people are getting onto Medicare is, am I going to need a referral to see a specialist? And we're so used to plans as we're under 65 that require that. But when you're on Medicare, it all depends on how your Medicare coverage is structured. If you have original Medicare with a supplemental plan, you will never need a referral to see a specialist. And you can see the specialist that you choose, not necessarily be limited to the one that is affiliated with your doctor's practice. If you have an Advantage plan, however, you're going to be limited to specialists that are within that network. You may need a pre-approval, and you may need a referral. And some doctors' offices are better at others than granting referrals. What happens if my specialist isn't in my plan's network? Well, that all depends on your plan design and whether your coverage is built around provider networks or broader access. If you have an HMO, if that specialist is not in your plan's network, you won't be able to see them unless you pay 100% out of pocket. If it's a PPO, your plan may allow you to go out of network, However, that specialist that you want to see, he or she is not obligated to accept that plan on an out-of-network basis. So even though your plan says it's okay, your mileage may vary. But again, if you've got freedom-based original Medicare with a supplemental plan, you simply ask, does this specialist accept Medicare? Number one. Number two, when can I get an appointment? And you go. This comes up sometimes too. Like, why do you spend so much time talking about freedom? Well, that's a great question. And it's because after helping hundreds of families the last couple of years, what I've found is that people rarely regret having more choices when their life suddenly becomes more complicated because of a serious health issue. What I've also seen is the flip side when people made a decision at 65 and now they're suddenly finding out that they don't have access to those choices. What's the Freedom First framework? The Freedom First framework is a simple way of thinking about Medicare that it starts with how you want your healthcare to work and provides the greatest protection for not only your retirement freedom, but your retirement income. And it's a way of looking at it differently than just looking at which plan has the lowest premium. A great example of Freedom First is my mom. When my mom retired, uh, she had a very small retirement plan, not a pension, but a very small retirement plan, savings that had to last her for life. And Social Security was a big part of her retirement income. And so for her, being on a fixed income, uh, one of the things that she wanted is she wanted to protect her retirement income. It's got to last for life. If she came up against the maximum out of pocket on one of those network-based plans, that would have been very hard for her to come up with the $5,000 to $7,000 to pay all those bills before that maximum out of pocket. So for her, having a supplemental plan with a clearly defined out of pocket limit and a monthly premium that she could budget for it, that was very important. But that wasn't the whole picture. That's just the financial piece. The other piece, which was more important, was her medical freedom. My mom's had a couple of serious, not life threatening or anything like that, but just serious chronic conditions, very well managed with a specialist. Well, what would happen to her if she found out that that specialist she's been working with for years didn't take the plan? She'd have to go and try to find a new doctor that did take the plan. She's in a rural area, so she already has to travel to go see a specialist. How much farther would she have to travel now? What about primary care? There's a limited number of primary care doctors where she lived. And what would happen if they didn't take her plan? So that was the other thing is I knew that she could not run the risk of doctors not taking her plan. So for my mom, a freedom-based plan was the one that really fit her life the way that she wants to live. And today, while she's in Florida staying with us, it works the exact same way that it did at home. So she has no disruption in coverage. If she needs to go see a doctor when she's here, she can do it. She doesn't have to get on a plane and fly back home just because, it's time for her annual blood work or she's not feeling well. So that right there is the difference in, and that's why I believe so strongly in the freedom-based framework. So if today's conversation has you wondering whether your current Medicare strategy supports the kind of retirement that you've envisioned, I'd be honored to help you think it through. You can go to medicarequotes.com/Facebook and you can grab some time on my calendar. Call the office 954-970-4760. Christine will get you set up with an appointment, or simply comment guide in the comments here and I'll personally reach out to you. I hope that today's conversation gave you a little more clarity, a little more confidence as you navigate your Medicare journey. If you found it helpful, I'd love it if you'd follow me on Facebook, like and subscribe on YouTube, and feel free to share this episode with someone who's approaching Medicare. My goal is simple. It's to help more people make informed decisions before they have to start making the important ones. Until next time, I'm Casey Album, your Medicare co-pilot, and thank you for joining me for another episode of Coffee with Casey, the weekly conversation that helps you navigate Medicare with confidence. And remember, the best Medicare decisions aren't made under pressure. They're made with a plan. I'll see you next time.